For the people blaming the doctors instead of the abortion bans for killing people, because the abortion bans are crystal clear, okay? Let's play a little game. It's called You're the Doctor, What Would You Do? I'm going to give you a real life scenario and you just tell me what you would do. And we'll use the Georgia abortion law as a guide. Scenario 1, we have a healthy woman that is 12 weeks pregnant, but she was diagnosed with HER2 positive breast cancer. Now, without any treatment, life expectancy is 1 to 5 years. But with treatment, survival rate is over 97%. The issue here is that Herceptin, which is the chemotherapy treatment, causes neonatal death. The woman talked it over with her husband and they decided to save her life and they would like an abortion. So what would you do? Well, first we'd check the law, right? Let's see if that helps us. Let's see. Removing a dead unborn child caused by spontaneous abortion or miscarriage. That doesn't help. Removing an ectopic. Nope. This baby is alive and a strong heartbeat. So we're going to have to go with the maybe medical emergency, although, see, it's a condition in which the abortion is necessary in order to prevent the death of the pregnant woman, which is not exactly the case here, is it? Like, the abortion's not going to determine whether the woman lives or dies. And keep in mind that you're going to have to explain this to a judge and jury of non-doctors and convince them that it was a medical emergency. Or, do you think you'll be able to do that? Because if you fail, you go to prison and your career is over. So, what would you do? Scenario 2 is a woman comes in with a partial abortion that happened because she took the abortion pill. Left untreated, it could go septic and kill her, but her body could just expel it naturally if given time and she'd be fine. So what would you do? Again, we'd check the law, which only allows you removing a dead unborn child that is caused by a spontaneous abortion. And spontaneous abortion means the naturally occurring death of an unborn child due to miscarriage or stillborn, which is not the case here. This woman took the abortion pill, so she doesn't qualify. So once again, we're going to have to go with a medical emergency, but she's fine right now. So she could just pass it and there'd be no problem. So do you think that she's like near death enough? Do you think you could convince a judge and jury that she was like at death's door and you had to act? Do you think you could convince them of that? Because if you can't, you go to prison and your career's over. So do you think you should just maybe wait a little just to see maybe she just passes it naturally? Just keep an eye on her and hope that she does pass it naturally and there's no problems, but be able to step in the moment that you see it might be going septic and so near to death that you'll be able to prove it in court. Just monitor it and wait and see. So do you feel comfortable doing something like that? Congratulations, you just killed Amber Thurman. Do you see how that happens? Do you see how these laws can cause a delay in the emergency medical care that an hospital has to give? So stop blaming doctors for trying to obey your stupid laws that are killing people.